If you're receiving Social Security, SSI, or SSDI payments, you need to hear this right now. There are critical changes happening this month that directly affect your benefits and how you'll receive them. This isn't just another routine update. These changes could impact your monthly payments and require immediate action on your part. Stay with me because what I'm about to share could make a real difference in your financial security. The timing of this September update couldn't be more important because we're seeing multiple significant changes all converging at once that affect millions of seniors across America. Social Security and Supplemental Security Income, SSI, benefits for more than 72.5 million Americans will increase 2.5% in 2025. But there's much more happening behind the scenes that you need to understand. The Social Security Administration has been implementing several major policy shifts throughout 2025, and September marks a critical transition period where many of these changes are taking full effect. Let me start with the most immediate concern that affects everyone still receiving paper checks. Starting September 30, 2025, the Social Security Administration, SSA, will no longer issue paper checks for benefit payments. This means if you're still getting your Social Security, SSI, or SSDI payments by mail, you have less than a week to make the switch to electronic payments. This isn't a suggestion or a gradual phase-out, it's a complete stop of paper check services. The government is moving to electronic payments exclusively to modernize their systems and reduce fraud, but this creates an urgent situation for anyone who hasn't made the transition yet. If you're still receiving paper checks, you need to contact your bank immediately to set up direct deposit, or call the Social Security Administration at 1-800-772-1213 to arrange electronic payments. Don't wait until the last minute because phone lines will be extremely busy as the deadline approaches. Now let's talk about the positive news regarding your monthly benefit amounts. Social Security benefits and Supplemental Security Income, SSI, payments for more than 72.5 million Americans will increase by 2.5% in 2025. While this might seem like a modest increase compared to previous years, it represents real money in your pocket every month. The 2025 COLA, which was based on third-quarter inflation data for 2024, boosted the average Social Security retirement benefit by about $49 a month. For many seniors, that's almost $50 extra each month, which can help with groceries, medications, or other essential expenses. This cost of living adjustment, known as COLA, is designed to help your benefits keep pace with rising prices, and it's calculated based on actual inflation data to ensure it reflects real changes in the cost of living. There's also fantastic news for many of you who have been affected by the windfall elimination provision and government pension offset, commonly known as WEP and GPO. These were rules that reduced Social Security benefits for people who also receive pensions from government jobs that didn't pay into Social Security. The Social Security Fairness Act has eliminated these unfair reductions, and as of July 7, 2025, we completed sending over 3.1 million payments, totaling $17 billion, to beneficiaries eligible for these restored benefits. If you worked for a government agency, school district, or other public employer and saw your Social Security benefits reduced, you should have already received back payments and increased monthly benefits. If you think you qualify but haven't received anything, this is the perfect time to contact the Social Security Administration to review your case. For those of you receiving SSI payments, there are some important scheduling changes you need to be aware of. People who receive Supplemental Security Income, SSI, will receive two payments in August 2025. The second payment, due on August 29th, is for September. SSI recipients will also get two payments in October 2025. The second payment, due on August 31, is for November. This means your payment schedule might look different from what you're used to, and it's crucial to budget accordingly. When you receive two payments in 1 month, Remember that the second payment is actually for the following month, so you need to make it last until the next regular payment date. The earnings limits for 2025 have also been adjusted, which is important news if you're working while receiving Social Security benefits. The 2025 earnings limit for people under full retirement age all year is $23,400. We deduct $1 from your benefits in 2025 for each $2 you earn over $23,400. This means if you're still working and haven't reached your full retirement age, you can earn up to $23,400 without any reduction in your Social Security benefits. If you earn more than that amount, your benefits will be reduced, but remember that these aren't permanently lost. They'll be added back to your benefits once you reach full retirement age. Looking ahead, there's already preliminary information about what we might expect for 2026. The Senior Citizens League, TSCL, estimates the COLA bump will be 2.7%. That's up from the 2.5% increase retirees received in 2025. While this is just an early estimate and the final number won't be announced until October, it suggests that benefits may continue to grow modestly to keep pace with inflation. However, many seniors are concerned that these increases don't adequately cover rising healthcare costs, particularly Medicare premiums and prescription drug prices. Speaking of Medicare, this is also the perfect time to review your Medicare coverage during the annual open enrollment period, which runs from October 15th through December 7th. Even though Medicare is separate from Social Security, the two programs work together, and changes in one can affect the other. If your Medicare premiums increase, that could reduce your net Social Security benefit, so it's important to shop around for the best Medicare plan that meets your needs and budget. For veterans receiving both Social Security and VA benefits, you should know that these programs generally don't affect each other. You can receive your full Social Security benefits regardless of your VA disability compensation or pension payments. However, if you're receiving SSI, your VA benefits might affect your SSI payments because SSI is a need-based program with strict income and asset limits. If you're a veteran receiving multiple benefits, I encourage you to speak with both the Social Security Administration and the VA to make sure you're receiving all the benefits you're entitled to and that your payments are being calculated correctly. This September update also highlights the importance of keeping your contact information current with the Social Security Administration. With all these changes happening, you want to make sure you're receiving official notices and communications. You can update your information by creating a My Social Security account online at ssa.gov or by calling their customer service line. Having an online account also allows you to check your payment history, verify your earnings record, and get important documents like benefit verification letters that you might need for taxes or other purposes. If you're helping an elderly parent or family member navigate these changes, remember that you can assist them in setting up direct deposit and understanding their benefits, but you'll need their permission and possibly legal documentation to speak with Social Security on their behalf. The Social Security Administration takes privacy very seriously, so be prepared to provide proper authorization if you're calling to help someone else. I want to emphasize how important it is to be proactive about these changes, rather than waiting for problems to arise. If you have any questions about your benefits, if your payment amounts seem incorrect, or if you're having trouble with the transition to electronic payments, don't hesitate to reach out for help. The Social Security Administration's customer service representatives are there to assist you, and while wait times can be long, it's worth the time to ensure your benefits are correct and secure. For those of you watching who haven't yet filed for Social Security benefits but are approaching eligibility, this is also a good time to start planning. Your full retirement age depends on when you were born, and filing at different times can significantly impact your monthly benefit amount. You can file as early as age 62, but your benefits will be permanently reduced. Waiting until your full retirement age gives you your full benefit amount, and delaying until age 70 can increase your benefits even further through delayed retirement credits. The key takeaway from all of this is that Social Security, SSI, and SSDI are constantly evolving programs, and staying informed about changes can help you maximize your benefits and avoid problems. These September updates represent some of the most significant changes we've seen in years, from the elimination of paper checks to the restoration of benefits for those affected by WEP and GPO. I hope you found this information helpful, and I'd love to hear from you in the comments about how these changes are affecting you personally. Have you successfully switched to electronic payments? Are you seeing the increased benefit amounts in your account? Share your experiences, because your stories can help other viewers who might be facing similar situations. To summarize the most critical points from today's update, paper checks are ending September 30th, so switch to direct deposit immediately if you haven't already. Your 2025 COLA increase of 2.5% should be reflected in your payments. If you were affected by WEP or GPO, check for your restored benefits and back payments. Be aware of the double SSI payment schedule in certain months. And remember the 2025 earnings limit of $23,400 if you're working while receiving benefits. Your next steps should include verifying that your contact information is current with Social Security, confirming that your direct deposit is set up correctly, reviewing your benefit statements for accuracy, and considering whether you need to update your Medicare coverage during the upcoming open enrollment period. If you found this video helpful, please give it a thumbs up and subscribe to stay updated on all the latest Social Security, Medicare, and senior benefit news. I'm committed to keeping you informed about changes that affect your financial security, so hit that notification bell so you don't miss important updates. Take care of yourselves, and remember that staying informed is one of the best ways to protect your benefits and your future.